My name is Rick Grindrod, and I'm the CEO of Provider Partners Health Plan. So typically, the Medicare program pays hospitals on a diagnosis-related group basis, where the amount that they pay for a specific diagnosis is determined ahead of time. In Medicare, or in Maryland, there is a waiver from that program, and Maryland for hospital financing has a completely different structure. In Maryland, there is a total global budget revenue number that every hospital is given by the Health Service Cost Review Commission, and that number that's what they have to manage all the cost of care related to the population of people that they serve. So that's very different from the way the rest of the country operates the Medicare hospital program. So I was the operations guy at Erickson for 20 plus years. We had a great and long history of taking great care of residents on a comprehensive basis, everything from dining options, health facilities, fitness facilities, physician practice, long-term care, home care. We really were a total program of care for the residents of those communities. As a result of all of that, we discovered through some statistical analysis that we were really lowering the rate of hospitalization in compared to the broader Medicare population. And so in 2005, Erickson received approval from Medicare to launch its own Medicare Advantage program. And that was really based on the idea of improving the quality of preventive care, improving the quality of post-acute care and pre-acute care, so that residents didn't experience the acute flare-ups of their chronic disease, so that we could prevent those chronic diseases from really moving to a debilitative state or a crisis state and keep them out of the hospital. And we were quite successful at that. I guess from my time at Erickson, the most important thing that I learned was as long as you're focusing on what's best for the patient and for the resident, then you can navigate through the payment structures of Medicare appropriately, because that's really what the folks at Medicare are interested in, is the best care at the best cost for their beneficiaries. 5 years from today, I think that we would see that the physician company, five-star physicians, real-time medical systems are both growing to serve a variety of different long-term care and post-acute providers. And I think that many of those providers in Maryland, Pennsylvania, and other states will have taken advantage of the insurance program that Provider Partners offers through Medicare Advantage, so that they can get the economic benefits for their members and for their patients of lowering the acute incidence of hospitalization. I think it grows pretty rapidly. There are certainly electronic medical record providers who are seeking to provide data mining as part of their programs, but thus far I haven't seen anything that is as simple to use as RTMS. From a competitive standpoint, certainly some of the big insurance companies are in the Medicare Advantage space, but not many of them are looking to focus on the needs of the residents that live in long-term care facilities. So I don't think while the competitive landscape is very active, it's not so much focused on the post-acute or long-term care settings. The biggest challenges that we faced at the startup of Provider Partners Health Plan is really understanding the insurance company environment. We're a provider-oriented organization with some newfound expertise in technology, but in terms of being experts in insurance regulation and CMS, the regulatory environment around the Advantage plans and the rest, that's been something that has been challenging that we've sought outside expertise for. I think success in 5 years is 10,000 members at Provider Partners Health Plan who are happy and satisfied to a high degree with the healthcare program that they have. We've reduced the cost of care and the incidence of hospitalization.